Hello, everyone. My name is Dr. Ashley J. Davis Ford Graham. Today, I'll be here to speak with you about important information regarding Black maternal health care as it is Black Maternal Health Week. So, some of the most common mental health challenges that Black birthing people face during pregnancy and postpartum would definitely be a lack of being listened to. It is so common that we see that Black birthing individuals are feeling minimized or dehumanized because the things that they are vocalizing as important to them, be it a question, be it a concern, aren't taken seriously. This goes back to that first question where I answered and said it's so important not only to think about the birthing individual, but also to think about their community, their supports, their tribe, right? Because within Black birthing families, it is oftentimes those people that help to show up, whether that be a midwife, a doula, a sister, girlfriend, mom, dad, husband, wife, cousin, the support team. So I think that when we talk about cultural strengths or protective factors, it is that community aspect that helps to keep the birthing individual grounded and supported, encouraged, right? And advocated for. In the short term, it means everything. Means everything because oftentimes Black birthing individuals may feel as though they are better understood or will have uh, an individual that is at least willing to listen to them, to help advocate for them, to help them identify the resources and all of the information that they will need to make their birthing experience as positive, as safe, as beautiful, and as understood as possible. And so representation in perinatal care, it is so important, and that doesn't just speak to mental health. That speaks to physical health. That speaks to all types of um, interdisciplinary collaboration for the birthing individual and their family, and having representation in all of those areas. That not only looks like having providers that may look like them, though that is a big part of it, right? But having providers that may understand them and their needs on a deeper level to be able to give them that platform to be heard, to be listened to be advocated for, to be affirmed. Providers that are representative can also help to encourage and develop that interdisciplinary collaboration amongst all of the providers to ensure that the birthing individual and their support team are receiving a comprehensive, collaborative work environment that is going to prioritize not only their wants and desires to have a beautiful birthing experience, but also their needs to support any stress, triggers, trauma, physical health that may otherwise not be highlighted. I think that is such an important question because this is a question that comes up a lot, and a lot of people, particularly Black parents, don't know where to start. The first thing or piece of advice that I would say is trust yourself. We tell birthing individuals all the time to trust your body, trust your instincts, but I would start there as well in terms of trust yourself in terms of the things that are coming up, the things that you have questions about. Knowledge is power, so begin asking questions and pushing back a little bit. A lot of times people can be worried or nervous about the pushback that they may receive, either from a provider that doesn't normally listen or may give them a hard time. But it's really, really important for Black parents to know that if they do not advocate for themselves and for their future children and family, then nobody will. So, if you are looking for where to start, especially with those feelings of anxiety, those feelings of depression, those birth traumas, ask for help. Ask for support. If you don't have anybody to ask for help, start to take some of that initiative, if you are able to do some of the research on your own. Look for a perinatal specialist, a perinatal therapist, um, providers that align with your needs and your wants. Use social media. Social media can be a powerful tool to find suggestions or to find direction for where to receive that support that you are looking for and that you need. And ask those questions, push back, because people might not like it, but prioritizing your needs, your family's needs, and your baby's needs are what's most important. You deserve somebody or a team that is going to listen to you, that is going to make you feel cared for, that is going to make you feel supported and help guide you to get you to the end goal of having a beautiful family, a beautiful experience, right? Even if that means being able to process difficult factors that come up. There are providers, there are people that are out there wanting to help you, that specialize in being able to help you, that are advocating not only for helping Black birthing individuals and their families, but for continuing to advocate for more and more representation so that we do not have to continue seeing stories about a Black maternal health crisis or people not being heard, deaths being preventable but not having happened. So know that you are powerful. Know that you are strong. Know that you have a voice and that it should be heard. You should be considered. You should be supported. And you are.